Namaste, I am Dr. Varsha, consultant in reproductive medicine, GarbhaGudi IVF Center, Bangalore. Today we will talk about PCOD and its symptoms, what is its treatment. We call a person is having PCOD or PCOS when their ovaries are showing polycystic ovaries, or when they are having irregular cycles, and when they will be having either clinical or biochemical hyperandrogenism. So nowadays PCOD is increasing in the incidence in our society. It's almost 20 to 30% of our young girls or the ladies are having PCOS. So what is the reason? What are the risk factors which will predispose for this? So usually the mother or their sister or their auntie or some relatives are having, close relatives are having PCOS, then the person is having a high risk of carrying PCOS. If the person is having sedentary lifestyle, like lot of sitting and doing the work, bad food habits like eating lot of junk foods and oily foods, sweets, and not doing exercises, obesity, these all things will predispose a person to have a PCOS or PCOD. So what are the clinical presentation? How a PCOD patient can manifest their clinical symptoms? Like they might be having irregular periods, they might be having anovulation, they might complain of inability to conceive, difficulty in having a pregnancy, they might complain of symptoms of hyperandrogenism, like they might lose lot of hair, there are unwanted hair growth on the face, and they might be having like pimples and hyperpigmentation in the body areas. So how do you diagnose? When you have to consult, if you are having a PCOS signs and symptoms, when you need to consult a doctor, when you have a irregular menstrual cycles is a one thing. Second thing, in spite of you trying regularly for the conception, you are having difficulty in having a pregnancy. Third one is if you are having a signs and symptoms of hyperandrogenism like hirsutism or hyperpigmentation or lot of pimples. In such cases you need to consult a doctor. What are the things they will do to diagnose your PCOS? So routinely they might do an ultrasound pelvis to see a polycystic ovarian morphology in the scan, and other some things they might do are hormone tests like FSH, LH, AMH, TSH and prolactin. These are the hormone tests, and testosterone value. These are the some of the hormone values they might give the test. And how do you treat the PCOD? The key factor in the treatment of PCOD is diet and exercise. Minimum of 30 to 45 minutes vigorous exercise you should do 4 to 5 days in a week, which will keep your hormone balance correctly in your body. And diet, you should avoid oily food, junk food, bad food, red meat and all. You should try to intake high protein diet, fruits, vegetables, try to eat a healthy diet. And PCOS treatment depends on the two factors, whether the person is planning for the pregnancy or they are not planning for the pregnancy. If they are keen on fertility treatment, then we might give them ovulation induction and timed intercourse, or we might give them an IUI treatment, some 3 to 4 cycles. If it is not working, the ovulation induction and timed intercourse and IUI treatments are not working, then we might suggest them an IVF treatment. If the patient is not married and they are not keen on planning the pregnancy, then we will put them on a oral contraceptive pills for 3 to 6 months to keep the PCOS under little bit control. But ultimately you should know diet and exercise are the key factors which will keep your hormonal milieu in control and control the PCOS. Thank you.